support for the Ministry of Health in Ethiopia, and knowledge management and generation, that is, we do the implementation research and deposition of different resources in primary healthcare so that we could share for our networks. And the fourth one is advocacy and partnership. That is where we advocate primary healthcare and as well the institute. So coming to the global primary healthcare program, that this let me share. So please, Bro, allow me to share my screen.
You have the right now.
Thank you. I think it's visible now, yes, Bro?
Yes, Tersit, we can see your screen well.
Okay, thank you. So as I tried to mention, this global primary healthcare course is one of the capacity building programs that we are providing under the global primary healthcare program. So here we'll be seeing the general supports or the program areas that we are working on under the global primary healthcare program. We'll also see the introduction to the course, objectives, content, structure, and requirements. So the global primary healthcare program support is majorly the major objective is in contributing to the improvement of primary healthcare system in low and middle income countries, especially in Africa. So here, while we are saying we are going to be contributing to the improvement of primary healthcare system, we develop and provide different capacity building programs, and that is the training programs. One of these is the global primary healthcare course, and the other is we establish different virtual trainings. We provide capacity assessments and technical assistance to implement different primary healthcare programs and strategies that the countries have selected. So just to summarize our program supports, we categorize our program supports in 3 buckets. The first one is the capacity building or the training programs that we are providing. For now, as an example, we have about 4 capacity building training programs. One is a global primary healthcare course that I will be talking the details in the next slides. The other is the harmonization and alignment course, in which this course is covering about the one plan, one budget, and one report. The other is introduction to primary healthcare course. This is a course that we briefly describe the general concepts and principles of global perspectives of primary healthcare, and as well the Ethiopian perspectives and some countries' case. And the fourth one, that we are providing is the creating resilient primary healthcare system, that we talk about some lessons we have learned from COVID and other pandemics. So initially, this course was initially started while the COVID-19 is emerged, to share how we best leveraged primary healthcare system to tackle COVID-19. response, and also other countries' experiences, and Ethiopian experience was shared at the moment. Then now we changed the title and the concept of the course to in creating resilient primary care system with the lessons we are learned from COVID and Ebola and other influenza pandemics that the world have been seen. So these are the courses that we are currently offering, but it's not limited to these 4 courses. Based on the need of our partners or our audiences or countries, we develop different courses related to primary healthcare system. So most of the time, especially the global primary healthcare course and the harmonization and alignment course has an embedded site visits to Ethiopia. So once the theoretical part of the course is given and provided for the participants or delegates, then they will come to Ethiopia and visit the primary healthcare settings and experiences here. So in bucket 2, after taking to the course and also in addition to taking these primary healthcare trainings and courses and the site visits, so we do the virtual post-training mentorship. So here, every time after the courses and the trainings have been taken, the delegates or the participants will prepare the country plan. So after seeing the experience, especially on global primary healthcare course and harmonization and alignment course, once the trainings are completed, the delegates will prepare a country plan. Then based on the instruction and the guide that we'll be providing, the delegates will do a country plan based on the experience I have seen here. So anything they would like to change or anything they would like to improve when they get back to their country, they will put it as a country plan. Then we'll follow up the experts and the facilitators here at the institute and ministry that we are working with us will be following up the implementation and the progress of this country plan virtually. Then in bucket 3, besides this training, besides the site visits and the virtual follow-up of these trainings, depending on the need of the country and the delegates in a respective country, follow it if they would like to implement the country plans based on the plan, and also if they have, it might be different from the country plan, or some countries may come without taking the course, but they would like to get an experience from Ethiopia, or they got an experience from other countries, but they would like to implement any system improvements in primary health care. Then we'll be supporting and providing an on-site technical support or a virtual technical support so that they could implement their plan or their improvement strategy. So this is how we do in global primary care program. So for now and for today, we'll be talking about specifically to one of our courses, global primary care course that you are going to join. You already enrolled, and you will be starting the course starting from today. So prior to this, there are a lot of courses. These courses have been provided for more than 20 countries, so different countries came. Even I think previously, a few years back, colleagues from Tanzania has also have been taking this course and field visits. But initially, these courses have been provided in a face-to-face or in a person modalities. Then delegates came to Ethiopia, they will take a short classroom session regarding to the primary healthcare system in Ethiopia. Then they will do the field visits and get an experience sharing. So considering that most of our audiences and delegates who are going to join this course are busy and COVID came, we think that this course might be in a blended format. So the participants will take the theoretical part of the course virtually. Then they will come only for the field visit to visit the primary healthcare system in Ethiopia. But initially, these more than 20 countries have been taking this course. So mostly, as I told you, the courses, the participants who are taking this course are leaders from ministry or from program implementers working on primary health care, and also partners for the Ministry of Health of the respective country. And the feedbacks were very positive. That's why we strengthened the course. We developed the course materials in an organized way, in a standardized way, and we make it from face-to-face to the blended modality. So just to give a general objectives or goal of this course is it explores the evolution of primary healthcare from the declaration of Almata to the recent time. So it includes also embedded the Ethiopian primary healthcare experience majorly, but it also incorporates other countries' primary healthcare experiences as a case study, so that you could learn from Ethiopian experience and from other countries' experience as well. But as the field visit is actually conducted in Ethiopia, so majorly the Ethiopian experience is discussed in the course. So the audiences are health system leaders who are actually actively engaged in planning and developing or leading of primary healthcare programs, policies in the countries, and the other public leaders and managers are expected to join the course. And the course is also actually developed to address the need of these audiences. So the major objectives are, it explains a core principle of primary healthcare system, primary healthcare concepts, principles, describes the structure and function of health extension programs through the lens of WHO building block and including the community engagement. So this course is organized in 8 modules. The 6 that is based on the 6 building blocks of the WHO health system building blocks, and the additional 2 modules are one is an introduction to primary health care. This is just to talk about the general principles of primary health care, declaration of Almata, Astana, and general concepts. Then the 6 building blocks, including the community engagement at last. So it also assesses how experience from the health extension program of the Ethiopia can be adapted to other contexts and create an action plan to apply their new knowledge and opportunities in your own country. So after getting the experience from other countries and from Ethiopia, then you could develop an action plan that you would like to make a change or to create a new initiatives in the country after seeing the experience here. So it has 8 modules. In every modules, there will be a homework, there will be reading materials, country plan will be developed, and finally a field visit will be conducted. So this time, I think some of the colleagues here, we have an initial meeting before this. So as we have tried to mention, this is a huge number we have received from Tanzania. So we cannot bring everyone to visit to Ethiopia, but we could, you could select specific colleagues who could delegate the team, then be able to come to Ethiopia and visit the primary healthcare system here to get the experience. So just to share the general objectives and contents in the course. Module 1 is, as I told you, the introduction to primary healthcare. Here we discuss the key primary healthcare principles, the 6 building blocks, the 14 levels of primary healthcare, and the general primary healthcare system concept and principles in Ethiopia is included. Module 2 is service delivery. This is one building block of the WHO health system building block. So it talks about characteristics of service delivery. It talks about health equity. It also talks about the Ethiopian experience, and the other countries' experience is embedded as a case study. Module 3 are regarding HRH, Human Resource for Health. It's also one building block. So it talks from the general structure, and it talks from the entry part of the health workforce in the health system to the exiting of the health system. So it's also discussed how migration and attrition could be managed, and regarding to this topic, the Ethiopian experience and other best experiences, also other countries' best experience needs to also be embedded as a case study. Module 4 is about health information system. It discuss about health system components, the reporting and the feedback mechanisms, and every component will also be discussed, and here the best experiences in Ethiopia also be shared. Module 5, another building block, is procurement supply management of commodities and essential medicine. So this is also a module that we'll be discussing on the supply procurement and supply management regarding the essential medicine financing system. So Ethiopian and other countries' experience will be also discussed. And module 6 is health financing. So the general principles and functions will be discussed, especially this community health insurance concepts and Ethiopian experience will also be shared. Module 7 is leadership and governance. Here it is, we discuss how well the primary healthcare system could be led and also governed, and the Ethiopian experience, especially the community scorecard experience will be shared. Finally, it's communities and community engagement. This is not directly part of the building block, but it is put and discussed well in the WHO health system concepts. So we also brought this concept because it is very important, especially when we talk about primary healthcare systems. So we discuss what's community, how community engagement would be helpful in primary healthcare, for especially how it's going to be sustained. And again, the Ethiopian experience will also be discussed here. So these are the 8 modules we'll be covering under under this global primary healthcare course. So I tried to mention earlier the course format and the structure will be every time the course objective and introduction concepts and principles will be discussed with general and global perspectives. And as this is an online, an embedded, a blended course, the online content is we have prepared or produced is try to be very engaging. So there will be an individual reflection activities that are engaged there, embedded there, so that you could interact. And so the learning will be more active and interesting. So you will also be share your country's experience and the other countries' experiences will be also shared there. So with case studies, and finally there will be a review of the module. You'll provide a feedback, and so that we could improve for future. So coming to the course requirements, actually, this is just for your information, but because we consider that you are selected because you fulfilled the requirements, and we already communicated this. You fulfilled the requirements to join the course. So yeah, the course is program implementers, leaders, and managers are already engaged or are expected to engage in this course. But once the participants or audiences are recruited and enrolled to the course and start taking this course to get a certification of certificate of completion from this course, you should fulfill these requirements. One is there will be a pre-course activity. Immediately, yesterday we enroll you to the course. So once you are enrolled and log into the course platform, you will get an introductory videos and course information. And also there will be a pre-course activity that you are going to fill out and submit to the platform or upload to the platform. So this pre-course activity is actually to share or to understand your country primary healthcare system. One is you'll learn your own country experience and understand, and you will read while you try to do this assignment or pre-course activity. The other is for us and for our facilitators and experts of this course. They could, once you submit these activities, they could actually learn from your assignment regarding your primary healthcare system. Then the course delivery or the examples and other things that you are going to have will be discussed based on the knowledge or the information we have regarding your primary healthcare system. So all 8 modules are expected to be completed. So you should complete every learning activities that are in the course, and there will be quizzes in each modules at the end of each module. So you should complete and pass that quizzes. It could be 3 to 5 questions and easy, but it could able to check your understanding of the course contents. So every time you complete each modules, you will earn a badge from the platform. Then that means totally while you complete the course, you will earn 8 badges. So once you complete the course, you are expected to develop a country plan. So this is not an individual assignment, but actually it is a group assignment. And then finally, we are expecting to provide a feedback. This is very helpful and important for us so that we could improve the course for the future. As I told you, it's difficult to accommodate everyone to the field visit. this is a requirement we used sometimes when we are actually evaluating or selecting delegates to come to Ethiopia for the field visit. But sometimes the country representatives from your respective country will be selecting based on their own criteria and let us know who will be participating to the field visits. But for us, we use these criteria. So it should be a country group. It should be the individual should be certified, develop a country plan. At least 50% of the live sessions should be attended, and also gets a support letter from the country Ministry of Health or Department of Health. So this is about the general course contents, requirements, and expectation from the participants. But we while you go through to the course contents, then you'll see, and if there is anything, any inquiries you have, any support you might need, you can reach us anytime, and you can learn a lot, I hope, from the course. So just as I told you, this course is a blended, and majority of the contents, almost the contents are delivered online. So, and you are enrolled already. I hope everyone have received the enrollment email yesterday. If not, you can reach us and we can fix the issue. But for the ease of accessing and navigating of the course platform, my colleague Bru will brief you how you could able to navigate and access the course materials in the platform. So I will hand it to Bru. So Bru, you'll introduce yourself and then continue to the presentation. Over
Great.
to you.
Thank you, Tursit. My name is Bru. I'm an online training manager for the institute. I'm basically a learning management system administrator and a learning developer. So I will walk you through the platform and show you some relevant features. So this is our learning management system in which you will be accessing all the course contents. So hope everyone in this call have received a welcome email from the course, which has username and password. It's basically like, since you are starting, if we have received your email in the list, your email will be your username. You can use your email as username always. If your email has capital letter, you can change that to lowercase and use that as a username. And then your initial password is change me. So it's change me. It's let me just, it's like this. Your initial password is like this. So during your first login, you will be asked to change this password and to use your own chosen secured password. So you can choose a password that is strong and that you will remember. So when you log in, you will see different courses, but in your dashboard, especially, the only course that you will be seeing is just one course if you are not enrolled in any of our courses before. So you can open the course and navigate it. So there is some description here. I can see about 81 of you have like started to progress on the course, and the other 308 of you are not started yet. So there is always when you need any supports, there is my email here. So I will be providing support for you, and you can use this email address to contact us for any help. So the course is organized as 8 modules, as Trsit have explained. There is module 0 here for like introduction, setting expectation, and things like that. You can also get some brief overview about the course in this section. There is also a pre-course assignment which will, help you to first assess your system at your level, whether it's a national level, a regional level, district level, or facility level engagement that you have. You can use the building blocks that are defined by WHO as blocks that can be utilized to build a healthy system. So you can assess your system through this assignment, and submitting this will help you achieve like the requirement. So this is the like a live session which was recorded from last session. I will replace this with the one that we are currently doing, but you can also refer that to get the info about the course. But I'll be changing that to this to make it more appropriate. So 3 modules will be released in a periodic manner, and when we release each module, you will be getting notification emails in your image. So if for example your name is not correct, if you want to change something in your name and things like that, you can come here in the right corner and click on your profile. Then you will be able to edit some details of yours. So here you can edit some details of yours, but we tried to use the appropriate naming based on the provided document. So each module will be opening based on your completion of like the prior module. So when you complete module 0, module 1 will be available for you starting from tomorrow. So this will be available. First, you may need to complete the pretest, and when you don't need to pass this pretest, because just on different aspects of the course. Then there are main contents, which are interactive contents that
Baruch, if you are speaking, at least I can't hear you. I'm not sure if it's only for me or.
Can't hear him. This is for everyone.
Yeah, Baruch, we cannot hear you.
I think this is for everyone.
No, so maybe he. Okay.
We can't hear you.
Okay, sorry. Group will hope will fix the issue and return to the again. So in case just until he join, if you have any questions, you can put on the chat and we may forward the answer. Anyone who haven't received the email, the enrollment email yesterday, please reach us and we will resend again or fix the issue. And sometimes because the organization email and the site from directly from the Zoom, sometimes it goes directly to the spam or trash category. So please check your email on spam or as well.
Can you hear me now?
Yes, now we can hear you.
Perfect. Okay. I think I had some issues with connection, and I actually have joined with another device. Okay, so I think I was explaining about these interactive modules, which are found in each module. So you should navigate through them, and there are like downloads hyperlinked in these activities. There are different knowledge checks, case study scenarios, and things like that within them. So you should complete each of them to successfully complete the modules each time. So when you are asked for reflection, you should submit. You should answer and submit for them. When you see, we try to, there can be videos embedded in them. We try to indicate when there is a need for action. So like this, you'll see something that is emphasized. For example, here, click on the plus sign at the bottom. So this is I think primary healthcare is explained as 3 legs stool. So each of them has like some clickable contents. So things are like organized in such a way. You can also use the navigation in your right, in your left side to navigate directly to the modules that you want. But since I haven't completed module 1, as you see, module 2 is not available for me. It will be like available when I complete the module prior to it. So this is how you will be navigating. You can also use your mobile phone to access this. You can also like have the Moodle app from Play Store or App Store and connect it to this if you want to use the app. So, but it's fully responsive on browsers too. So you can use your Chrome or Safari browsers on your mobile phones. And at any point, if you face any difficulties, you can let us know, and we can assist you in fixing that. Thank you.
Thank you, Guru. So I hope everyone gets an insight how you could able to navigate the platform so that you could easily access the course contents. So actually it is a very friendly platform. We hope you will not face any challenge, but still, if there is anything you faced during the navigation of the platform, or if you haven't received an email to log into the course platform, you can reach us anytime. So our contact is with Dr. Ernie. So you can reach us through him. And also on the emails, you can access, or you can get our email address, so you can directly email us. So this is how we would like to give you a brief information regarding to the course, and course platform. So let us know if you have any question, anything you'd like to check before going to or starting the course.
So I think I see some questions in the chat.
Okay.
So about module 0, I think we are now trying to be more flexible, and you will be like having access to module 1 starting from tomorrow, because we don't have that much time to release these modules in very strict 1-week duration way that we used to do this time. But still the requirements are like in module 0 to submit the pre-course activity so that you'll like get prepared to start to module 1. So I think the pre-course activity is the only activity that is required in module 0 for now. And about the accountants, if you don't have the email received to your like email address yesterday, I think it's better if it can be organized and sent to us, so that we can identify, who haven't received the login details yet. And it's good to confirm if your email address is correct on the shared document. So because like a single spelling error may like cause the issue. So that's yeah. These are the issues, I think, from me. And I see also another question. Is there a constant mode of selecting field work, or each country will select based on criteria? So I think if it's about the selection criteria for the field visits, I think Sweet may like address this later.
Yeah. Regarding to the field visit selection, for us, we were happy to if everyone could able to see the experience, but unfortunately, because of the limited, your case is different. It's a huge number, and besides, it is very resource intensive. So we are forced to limit the number. So we have a set of criteria, as I tried to show you. It's based on the certification and based on the performance if it's necessary. But probably sometimes, even though it is performance based or other criteria. So I think with the team agreement and discussion, you or the coordinating team may select some of the members who are able to delegate the team and bring the experiences from Ethiopia to the colleagues in Tanzania and share the experiences. But so those criteria, the field visit criteria we have been showing is for those who are joining individually with our promotions from different countries. So unless they came in a country modalities with the support of the Ministry of Health, will not be accepting the delegates. But for your case, you are already selected in a group and organized in a group with your ministry health delegates or coordinators selection. So I think it should be your coordinating team and with a discussion of our team, we'll identify some colleagues and our team representing the whole team to visit Ethiopia and share experiences. So we have a criteria, but it's kind of flexible depending on the interest of the Ministry of Health of the country. Yeah, the timeline I was about to share the time frame. Let me show you. It's a very intensive, especially when it comes to your case. Initially, we were doing or expecting for the participants to complete 2 modules in a week time. So totally in 4 weeks, all 8 modules will be completed. So 1 week before for module 0, and additional 1 week will be giving to complete any activities left with the participants, and also to develop or finalize the country plan and other things. But this time, because the schedule for field visit is in September 20, so everything should be completed before that. We could give you, for some of the participants who will not be joining the field visit, we may give some time to complete some of the activities, but for those but for majority, especially every time you complete the modules, at least 2 or 3 modules, there will be a live session with the experts to wrap up the module. So we encourage everyone to complete the modules based on the schedule, so that the discussion or the live sessions will be more productive. So for module 0, as Bru mentioned, we are expecting everyone to starting from yesterday, but actually because we didn't give an orientation, we'll have an excuse for that. So immediately, starting from tomorrow, you could able to have an access for 3 modules. We'll open module 1, 2, and 3. That is Introduction to Primary Healthcare, Primary Healthcare Service Delivery, and Human Resource for Health. Then in 10 days, you should be able to complete these 3 modules. And in August 28th, you are going to have a live session with experts after completing the 3 modules. So whether you have completed or not, the live session will be held, but it is very important you complete the module so that the discussions and the important information that experts will be sharing will be give more senses. So then this is the plan. Then module 4 and 5 will continue after that, after starting from August 28 to September 3. Then in September 4, we'll be having live session for 2 modules. So here in this live session, we will not discuss everything there. The only thing we'll be doing is the experts will come and pinpoint very major pointers that provoke the teams or the participants for discussion. They may ask questions, or they may brought some discussion points so that you could able to discuss. And it's majorly expected from you to ask questions, to share experiences, so that the discussion could be held and very productive. Then module 6, 7, and will continue starting from September 4. Then on September 13, it will be on the live session will be held for the 3 modules. So this is how we organize the modules, and for those who is going to be come to Ethiopia for the field visit, it will be on September 20. So this is how the schedule and how the modules are organized. So we will be embedding the schedule to the platform, so that you could go with the plan. So we will not be flexible this time, as Brooke mentioned, because it is very time sensitive. So please make it time. It is a very easy and very interactive and interesting modules we have in the platform. So if we make 3 to 4 hours in a week, or then you could able to finalize the modules on time. So I would like to encourage you, everyone, please to make it time, so that you complete the modules based on the schedule. So at the end, once you complete everything, you attend the sessions, you'll get a certificate of completion for the course. Any other questions? Okay, so it's not a must to forward the question here once you start the course. If you face any challenges, if you have any questions, anytime you can reach us through our email or WhatsApp number. Then you could respond to your inquiries. So everything will be shared, the timetable, and as well other resources you will get on the platform. I think if you don't have any questions, so we can wrap up our session here. So you can reach us anytime. So please start the course starting from today, from now, so that you can go as per the schedule. I hope you'll enjoy the course and learn a lot from the experiences from Ethiopia and other countries. So enjoy your learning.
Thank you. Good afternoon.
Within my peripheral vision, right? I walk race forward. I like I never saw you. And it's 100% believable that you will have to pinch yourself to make sure that you are alive, to make sure that you're breathing. Because in your mind,